So
Thank you.
thank
Have
you for
fun.
joining us. Thank you. Watch. Thank you for everyone for joining us for this panel. I'll go right into it. With only 0.1% of the world's population, Israel routinely ranks as one of the powerhouses, top countries in the world across a range of metrics, including research and innovation, number of startups, VC investment, etc. Today, we're going to focus on one particular sector, healthcare. I don't know why, but everyone seems to be talking about healthcare lately. So if it's in the news, we got to cover it. And there are 3 Israeli companies that are doing amazing things that not only address the current COVID crisis, but will be shaping our world in medicine and health for decades to come. So I'm going to do a quick round of introductions and very brief bios of 3 very talented speakers. Elia Tagar is the VP for Business Development at Diagnostic Robotics. His prior roles included working at McKinsey and as a consultant for the United Nations Global Compact. He also spent 12 years at the Clinton Health Access Initiative, where, among other projects, he worked with the governments of India, South Africa, Ethiopia, and Kenya, and other developing economies to create health insurance plans in those countries. Manny Schickman is the Vice President for Business Development and Partnerships at TytoCare. He has a unique blend of Fortune 500, mid-size, and startup experience, and has worked as a senior-level technology executive, launching new products and business divisions in both software and healthcare. He holds two U.S. patents for work related to the mapping of clinical workflows. Nimrod May is the Chief Commercial Officer for Sonorax. His extensive high-tech experience includes VP of Marketing at the taxi-hailing app Get and is CEO at Rafael Defense Technologies Investment Fund. In 2017, he joined Siren Labs, which concluded the 4th largest crowd sale in history, raising almost $160 million. There is much more to each one of them. These are very substantive people, but go Google them when this is over, not until it's over. And I'm Brian Abrahams, the Executive Director of Israel 21C. Our over 130,000 subscribers and millions of visitors to our website have access to over 13,000 articles that range from tech to humanitarian, from fashion to food. This week's magazine out today has an article about the 9 Israeli tech companies that ranked in Boston Consulting's 100 Tech Challengers for 2020, and the 6 Israeli inventions that Time Magazine put in its top list for 2020. So subscribe. All 3 companies we're going to talk about today were covered by Israel 21C. So let's start with Elia Tagar of Diagnostic Robotics. Elia is 1/3 Israeli, 1/3 Australian, 1/3 American, or something like that. And he has 2 soccer-crazed 8 and 10-year-old boys. So Elia, judging by the name of your company, Diagnostic Robotics, you must make robots.
We do not. We
All
came
right,
up with
tell me what you do.
Sure. So the original idea was to put together AI and robotics. We have some of the most inspiring founders in both spaces. The founder of Mazor Robotics and Kira Radinsky, who's a bit of a star in the AI space. And then we realized that there is a whole lot that we can do with AI alone. So the robotics is for future vision. It's still there in the background, but really the focus is on understanding how much we can do with AI. And very briefly, we do 3 things. We help to navigate patients to the right place. So for example, helping a patient decide if they need to see a specialist or a PCP. We help to automate the initial clinical intake of the patient. So whether it's a virtual visit or in-person visit, we automate that initial 3 to 5 minutes, generate a medical summary, and then you start with a session that is much more efficient and effective. And then we do population health, where we help to predict risk in advance. So, we can look at claims data and say, Elia Tagar is not taking his hypertension medication. Let's get onto him before he turns up in the emergency department with a stroke. So
you're taking enormous amounts of data and you're applying AI to it. So let's make this practical. What role did you play in Israel's COVID outbreak with predictive capacity?
Sure. So Diagnostic Robotics was the official partner for the Ministry of Health and the HMOs in Israel to help generate or create an input tool that any patient in Israel receives in the mail. So my mother lives in Jerusalem. She got a ping from her HMO saying, please log on to this tool and tell us how you're feeling. And then we are able to take those responses and create a heat map that helped the Ministry of Health in Israel to see, you know what, that little town in Nazareth in the Galilee, we're seeing a little spike there. You're not seeing it in the official data yet, but we are seeing symptoms there. It helps us to track city by city. This is what the official numbers are showing us in terms of positive tests, but this is what we are seeing in terms of symptoms, for example. And that helps to shift the policy response, allocate resources, etc.
So you were able to tell the Ministry of Health what town or village might have a spike in COVID.
We're a part of the solution. I wouldn't want to pretend too much, but yes.
And did you need everyone in the town to fill out the survey?
No, the beautiful thing about it is that you don't need 95% participation. Even if you get 5, 10, 15% participation, you can begin to see a hotspot emerging. And again, the idea is not to be 100% precise. The idea is to help give an indication of where the epidemic is trending, get an early indication if you can, so you can shift resources.
So you did that. That was work you did in Israel. One of the states in the U.S. where you're very big is Rhode Island. Tell me what you're doing in Rhode Island.
Yeah, so the governor of Rhode Island actually met with our founder, Kira Rudinsky, in Israel, and she originally asked us to help with Medicaid costs, the opioid epidemic, et cetera, which is something we are working with them on. But then when COVID hit, she turned to us and said, guys, this is the biggest thing in town. We need some help there. And so very quickly, we took the patient intake process that we have, and within 10 days, literally, launched a product that is currently the official COVID intake or triage process symptom checker in Rhode Island. You go on the Rhode Island Ministry of Health, you click on the little orange button, and it takes you through our tool. And the idea there is to help a system that could very easily get overwhelmed with the worried well, the sick, to help to take some of that volume away. So if I'm worried because I have a headache, instead of calling a doctor or a nurse who should be spending their time with really sick patients, I have something to give me the guidance of what is the right thing to do. Should I isolate? Should I not? Should I go to the hospital or not? Should I get a COVID test or not? And that guidance is based on CDC guidelines, but also very importantly tailored to this time and place, because Rhode Island in April is a different story than Rhode Island in May, is a different story than Rhode Island in October, is a different story than Kansas or California.
Okay, so that's fascinating. So you also mentioned you can identify people at risk, individual people at risk. So you work with large insurance companies. Tell me what you would then do to identify people at risk and flag them.
Absolutely. So we work with some of the largest, two of the largest national insurance companies in the US, as well as HMOs in Israel and a few regional players, to look through massive amounts of data. So we have 60 billion data points, and identify patterns in the data. And that can be anything from a very basic, as I mentioned, we see that Eli has been taking his hypertension drugs, and all of a sudden he's no longer filling the prescriptions. Or Elia is now being diagnosed with a behavioral health issue, with deep depression or anxiety. And we know the computer can tell from the data that is highly correlated with not taking my chronic medication. And so we can then flag that to providers and to payers to say, give Elia a call and make sure that everything is okay. In the case of COVID, we are seeing tremendous interruption of care. Because patients with chronic disease or cancer don't want to go to the hospital because they're vulnerable, right? And so we are seeing patients who would otherwise have checked a lump in the breast early on and now are coming with stage 4, or when cancer has metastasized. We're seeing patients with hypertension who are not maintaining it under control. And so what we can do is work with payers and work with providers to identify those patients who are at highest risk, and then try to proactively reach out to them as early as we can. We know that a lot of payers and providers have the capabilities of reaching out to patients, but they have limited capacity. We cannot go out to every single patient who has hypertension. We cannot go out to every single patient who has diabetes. But if we can help them identify with AI those who are most likely to be hospitalized in the next 6 to 12 months, it saves them money, obviously, so there's clear commercial incentives. It also helps to target those patients who are most likely to suffer and therefore improve their health in the most efficient way.
So you're helping the patient, but you're also saving the insurance company an enormous amount of money from a surgery, hospitalization, stroke, et cetera.
Absolutely.
Amazing. Is diagnostic robotics still open for investment?
We are. We raised a very successful Series A late last year. But we have tremendous opportunity for expansion here. We're looking at a lot of demand, frankly, from both payers and providers. And so we are open to some investment to allow us to capture that growth.
Excellent. All right, Elliot, don't go anywhere. We may come back to you if I have the time. I'm now going to go to Menny Schickman, who's Vice President at TytoCare. Menny has a 6-year-old son, another coming next month, so I'm glad we caught you while you still have time. So Menny, tell me what TytoCare does.
So in essence, you and I'm sure that anybody else on this call and on this forum as well, consuming a lot of things from their own couches in their living room. So now you're making your purchases, you're getting your food from the couch. So why not receive healthcare in a similar way?
Zoom adds 20 pounds. I'm much thinner in person. I'm not this fat in person, but keep going.
And I think from that perspective, you could say, well, telemedicine does exactly that. You kind of can talk to your doctor from the convenience of your home or from your couch. But since you mentioned my 6-year-old son, I'll give you a little story, and always a story I like to share. If he wakes up with a pink eye and I can almost self-diagnose him, and all I need is a prescription, sure, I'll use an app on my phone to talk to a doctor. But if he wakes up with a cough and a fever, unless a doctor can physically listen to his lungs and examine him, I would not trust any video doctor for that, right? And so TytoCare kind of breaches that gap. It allows me as a parent to feel comfortable enough with connecting with a doctor virtually. And so how do we do that? We do it with technology. We have a platform and physical devices that allow through both hardware capabilities. So in this case, I just created a stethoscope, and now it's in my home and I can examine myself or my child. This data flows to a doctor, and the doctor can then effectively diagnose my child, and me as a parent would feel much more comfortable with getting that type of a diagnosis in the scenario just described on my kid, as opposed to now being worried, well, that the video doctor was careful enough that to examine the child properly via video. Now he has actual vitals provided by TytoCare, and that includes the sounds of the heart and lung in conditions that require that. For children, typically physicians always look into the ears, so you can actually have a full-blown otoscope at your home. You can look effectively into the child's throat or your own throat, right, for an exam. So all of these capabilities are available through hardware, and one of the biggest Tyto's achievements is it was able to take very complex set of diagnostic exams, such as a heart exam, a lung exam, and so on, and completely consumerize them. So we have very advanced AI self-guidance capabilities that allow any consumer at the home without any type of clinical education to be able to effectively collect all of these vitals and send to a clinician. And now we're moving more and more into sort of the AI decision support and predictive analytics stage, where we can actually look at these unique data sets, such as, for example, sounds of the lungs, and identify wheezing, and actually instruct providers in where do we hear pathological sounds versus healthy sounds.
So while we're talking, hold up the device a bit. So the white device is the main TytoCare device, and then that's the main device. And then there's attachments to it that allow examination of other vital signs, et cetera. So it helps you both examine yourself without a doctor, but also give data to your doctor to make decisions, if your doctor accepts it.
So you can examine yourself with a device, or alternatively, a doctor can connect to the device remotely in a live exam mode and actually do a live exam. That would be traditionally what telemedicine does. So you have a video conversation with a doctor, but now a doctor can reach out beyond the screen and actually physically examine you in real time. So that's another way of operating.
So it's useful for people at their homes. What about other settings? What about institutional settings?
Great question. So what I'm showing you now is what we call the Tyto home device, but we also have a professional set of devices that's designed for clinician-to-clinician interaction. So for example, if a health system wants to extend their reach into long-term care facilities, as elderly is the most vulnerable population. Ilya mentioned, cancer patients, that's another set. So how can a health system or a state health department effectively extend their clinical capabilities and reach to communities, either urban, suburban, or rural communities? So these professional devices can be placed in long-term care facilities, in schools, in community centers, in work sites. We see a lot of employers creating these back to work initiative and creating safe workspaces. So TytoCare can be deployed at the last mile, which is the home, but also in the communities, and allowing that hub and spoke model with health systems and health departments.
So one doctor can cover a much larger geographic area by using data from people's home devices or it's clinical institutional.
Exactly right.
And what about battlefield or humanitarian disaster situations?
So yeah, great question. There's a lot of use to this type of technology, definitely in humanitarian and disaster areas, because again, you have this scarcity of care and providers, and now you can extend reach and have Tyto clinical units in a mobile version being in a backpack, and having providers and non-clinically trained individuals being able to then provide care to injured people on the ground. And same deal with military and other installations where you have forward bases, you have limited clinician access, and you can have medics in those local sort of localized areas with forward bases having access to specialists and primary care physicians through Tyto technology.
And will the device also help with COVID? For instance, have hospitals been able to send people home or keep people home with the device rather than hospitalizing?
Great question. So vitals such as definitely temperature, things like pulse oximetry, but most importantly the stethoscope, which is very effective in identifying early signs of fluids in the lungs, early signs of pneumonia. These are all derivatives of COVID. So what TytoCare was able to do is both on the post-discharge use case, so patient after hospitalization being discharged and still requires monitoring, or prior to discharge, if a person is infected and requires quarantine, this type of a device and this type of capability allows physicians, without exposing themselves to the virus, actually effectively manage these patients at the home and saving costly and valuable bed at the hospital to a much more acute patient that actually requires physical attention. And so we had tens of thousands of patients globally being able to quarantine themselves with Tyto devices and being monitored effectively at home, either before hospitalization, maybe not requiring hospitalization because they get well, or post-discharge since they require monitoring because of some of the damage to the respiratory system.
So the TytoCare device is amazing, but what amazed me even more is I could buy it at a well-known U.S. store.
Yeah, today. So that's true. So a lot of our business comes from our healthcare partners. So we work with large hospital systems, large insurers in the U.S. So health systems like Ochsner in Louisiana, large rural health systems like Sanford in the Dakotas, Novant in North Carolina. So they can actually offer Tyto device to their patients. But generally speaking, any consumer within the U.S. can actually go to a Best Buy and get a device and get connected to either our national telemedicine partner, who happens to be American Well, one of the largest telemedicine companies here in the U.S., or alternatively get connected to one of our local partners in some of these states that I mentioned.
So you can either try to convince your doctor to accept. What is your experience with doctors accepting the TytoCare device?
Great question. So a lot of the large health systems are already using Tyto technology, but the beauty of TytoCare and our consumer-centric development efforts is that we're allowing both to connect to the larger health groups, but also your own clinicians. You can actually send data to allow continuity of care to your own family practitioner, to your pediatrician, a specialist that you know, so you can actually choose which providers you share your Tyto exams with and get diagnosis from.
I checked before our session. It's on sale at Best Buy for $250. I have 3 kids older now that I would have saved 1 million visits to the doctor to have their ear or throat looked at.
Absolutely, and that's and as I mentioned, the story of our founder. He had a child with chronic ear condition, and he's an engineer. So he got sick of being in and out of physicians' offices. So he thought about inventing a technology that will allow him to work and stay at home efficiently, but still take care of his children.
So you may accelerate, your device may actually accelerate the movement towards telehealth that COVID started.
Absolutely. Yeah, I think telemedicine as an industry has what I would call a chronic condition, which is underutilization. Because of that lack of trust of a consumer in their ability to receive proper care through telephone or video, having a Tyto capability allows us to build that trust and actually engage the consumers and grow utilization at least 10x. And even before COVID, we're able to show consistently very high utilization results. So for example, before COVID, traditional utilization numbers were somewhere between 2 to 5% for telemedicine. TytoCare was able to show between 38 to 40% utilization. Through COVID, as probably a lot of the folks that are participating in this forum know, there was a spike in telemedicine utilization, but now it's stabilized and slightly higher, but still very low utilization, around 12%. And TytoCare can, post-COVID, during COVID, by the way, we were closer to 100%. Now we're at 60, and in some use cases, such as, for example, families with multiple kids, we're closer to 90 or 100% utilization. And in lay language, that means that any household that has a Tyto device consuming telemedicine. So they start changing their behavior and seeing telemedicine as a gateway to primary and urgent care.
Is TytoCare still open to investment?
Yeah, so we just finished a round led by Insight, one of the major funds here in the US and of course globally. But yeah, we're strategic investors are always on the lookout, and so are we.
All right, don't go anywhere. Now we're going to shift to Nimrod May of Sonorax. Nimrod is a strong man. He has 3 daughters ranging from 18 to 3. So Nimrod, Sonorax existed before COVID, but has tremendous 2 tremendous solutions for the COVID and post-COVID world. Tell me about that.
So first of all, I don't know if anybody knows what Sonorax is all about. So with your permission, I would give a very simple explanation of what we do, because it's simple to describe. We use sound waves to transfer data. So basically, with any kind of speaker and microphone who can run our algorithms or SDK, we can transfer data from basically mobile to mobile, machine to machine by using sound waves.
When you use your mobile phone, you're using either cellular, Bluetooth, or Wi-Fi. You're using a fourth method, which is the sound, actually the microphone and speaker of the phone. Okay, go ahead.
Correct. We basically developed a new connectivity protocol, which is using sound waves. In our case, we chose to use the ultrasonic range. The threshold of mobile devices ranges between 17.5 to 20 kilohertz. And that enables us to use any mobile device, even from old versions. And before COVID-19, we were very focused on basically making our algorithms run more smoothly. We are the only protocol that can run while the user is in motion, which entitled us, for example, at the first place of the payment competition in the French retailer Carrefour. We were very busy on finding use cases for location-based services and also on pairing IoT devices using our protocol. And then came COVID-19. And we tried to learn how the world is going to be, assuming there's a new term called the new normal. And we realized there are basically some repetitive words that we hear from the media outlets. One is contact tracing, and the other one was touchless. And when we heard that Google and Apple are going to be joining forces for the first time to enable contact tracing based on sharing the Bluetooth resources of the mobile devices, our engineers started screaming and saying, "Oh no, please don't use Bluetooth for contact tracing." And the reason that they said that is, I don't know how many of you know that Bluetooth basically runs on radio waves, and radio waves are amazing. They have their very unique physical properties. However, they have a tendency to travel through walls, ceilings, and floors, which would probably cause what we call a false positive contact. For example, when you're in a clinic and you're about to get a checkup, and on the next room you have a COVID patient, if you do contact tracing and you do the shared resource of Bluetooth, you might be identified as somebody who was in close contact. This will never happen when we use basically sound waves. Sound waves and their physical properties prevents them from traveling through walls and ceilings, and basically they're confined into the premise where the broadcast is being done. That led us actually for the first time to move out of our comfort zone and develop a product. We were a deep tech company focusing on software and SDK. And for the first time ever, we finished the development of SonarXC, which is a contact tracing platform that is now ready to be handed out to our clients. And basically, it's a very simple tool to facilitate contact tracing, to maintain a safe work environment, state, locations, et cetera, et cetera.
So Nimrod, while you're describing that, Matt, could you please pull up the first slide? So this is something I'll see on my phone. Matt's going to show us if I'm in the safe zone. Maybe. The wonders of Zoom. In any case, it display. There we go. So tell me what we're seeing here, Nimrod. So this is what we see on your phone if you've had no contact with anyone.
Actually, I don't see the screen, so I apologize. I don't know what you're showing, but okay, I can assume you're showing one of the screens of our mobile applications. So the user carries a mobile application. It's an enterprise app that is geared with our SDK or a white label application. And what it does, it's basically it silently and privately document meetups between people by basically doing these ultrasonic handshakes.
So Matt, give me the next slide, Matt.
And once someone was found as a COVID carrier. He can self-report through the app or through his superior. And this is where magic happens. This is where we can run automatically the entire route, his epidemiologic route, all the meetups that he had and are considered to be a threat that might need to send him either to quarantine or to a checkup.
Got it. So Matt, show me the last slide. So if I'm in a factory and I've deployed this, first of all, there's no equipment yet. Everyone just downloads the app, right? And their phones. And then HR, if someone gets sick, HR can say, okay, can reverse engineer and say, who passed near this person and when? And they get this screen that you can't see, but it says urgent alert, you've been exposed.
Yeah.
All right,
correct.
Matt, you can pull it down. Thank you.
And let's discuss the other use cases with your permission, Brian. The touchless. When everybody was talking about the new enemy, we were basically talking about something which is invisible. It's a virus, and it created a lot of, I would say, concerns whether people should push the buttons of their intercoms or anything in regard to access control, elevators, etc., etc. So we came up with a suite of solutions to enable touchless interactions within the physical world. We were approached by several OEMs that basically elevator manufacturing companies that wanted for the first time to take even their old modeled elevators and to enable the functionality of an elevator by a mobile device. So we installed a $10 microcontroller to an old elevator brain. The controller was equipped with a microphone and a speaker. And we coded the functionality of how to order the elevator into a mobile application very easily. And now you have elevators running through a mobile device. You can make them smarter very easily by programming, for example, the user which floor he usually travels to. So, you know, technology can now take many, I would say, apparatus and devices around there and make them much more safer. We just secured a deal with one of the terminal manufacturers for payments to facilitate touchless payments. I can't disclose the name, but a big company in the US, a known company. And well, I really hope for humanity that we would not need any kind of touchless. And I think physical interactions are very important for mankind. But we are here to serve any kind of situation which we will need to address and where our technology can be suited for.
Excellent. And is SonorX still open for investment?
Yes, we are.
So amazing. I want to thank, unfortunately, they were very strict with me on time. We run out of it. But I'm really grateful. Elia, Meni, Nimrod, thank you so much. I want to thank the organizers of Northwest Techfest, Amy Friedkin, the board chair of Israel 21C. And if you were a subscriber to our free newsletter weekly, you would have known about these three companies a long time ago. So Paige, thank you so much for having us and for showcasing all of this.